Welcome. My name is Unity Stoakes, co-founder at Startup Health. Today, we are speaking with two extraordinary founders, health transformers from CoachLinq, from InHealth, Aubrey Sawyer and Dr. Michelle Alencar. Longtime health transformers in Startup Health, and they've been building for about 10 years. We're going to do a check-in on the extraordinary journey they've been on. So stick around. We're going to learn all about CoachLinq from InHealth and the lessons learned.
Crazy dog.
Aubrey, are you there?
I am.
All right. You're making my day. How are you?
Doing well. How are you?
I'm good. Do we get Michelle as well, or just you today?
Nope, she's on her way.
Oh,
Just
I
make
see her.
sure
Here
we were prepared, so
she's
she
coming in
could-
now. She's coming in now.
Okay.
I like the background. You got the
Thank you.
CoachLinq logo and cool picture, and I love the branding. Hi, Michelle. How are you?
I'm doing well. Thanks for having us.
I've been looking forward to this because I gotta say, you guys are the vision and demonstration of health transformer, of perseverance, coming out on the other side of lots of extraordinary progress. So, first of all, how are you both, and where are you both today?
Doing well. Yeah. Thank you so much for having us and just taking the time to meet with us today. We're just so grateful for you guys and happy to reconnect, right?
I know. Well, I think you guys have been long time health transformers, I think going back to 2018,
18.
maybe. And you've been building for, is it almost your 10-year anniversary or?
It'll be 10 years on December 15th.
Wow. Well, congratulations. That
Thank
is a
you.
milestone. And I know your name is now CoachLinq. Just to level set, can you kind of frame what you've built, what CoachLinq is, and it's not a startup even. You've been really building, you've demonstrated tremendous progress, but maybe just describe the health coaching solution you brought to the world.
Yeah, so we still very much have InHealth. InHealth is still very much a company and still running. CoachLinq is actually a new spin out, right?
Okay.
So this is our new spin out and it is all technology. That is what CoachLinq is.
Okay.
So InHealth, what we've done is we've kind of repositioned things a little bit where now InHealth can really be what it truly is, which is the engagement and the IP and the infrastructure and the content, the programs, the credibility that we've built through our, National Board of Health and Wellness Coaches Accredited Academy, like all of the clinical trials that we've done, the publications, everything that is all InHealth. And it is the human coaching component, and that is the delivery mechanism piece. And then what we've done is we've actually built a new spin out, which is CoachLinq. And it basically is now going to be the technology piece that is going to drive awareness and engagement, but it's also going to be its own certified health coach. So it can drive outcomes on its own as well. And then really drive patients back to the human coaching and all of these other solutions that are so wonderful and readily available, but people just don't know about. So that's what we're doing.
I want to double tap into that because I've always thought your solution's really interesting because it's not just technology, it's technology plus clinicians or plus coaching, plus coaches. And that marriage, I think, is really significant in the age of AI. Can you talk a little bit about that? And because I think this predates the ChatGPT world of AI. You've kind of had this philosophy for years. Maybe describe that and why that matters.
Yeah, maybe I'll jump in on that one. We've been running this engine for, like you said, nearly a decade now, doing everything through humans. Everything is rooted in science, rooted in evidence-based practices. So we decided to have and build our academy, right? Because we wanted to ensure that our coaches were well-rounded. They got the board stamp of approval. We have CDC recognition as well for our diabetes prevention program, all the way back from the beginning. So we wanted to take all of those credibility factors and ensure every coach that touches the platform or any of our customers that are being deployed have that same foundation. So from there, we were able to learn over a cohort of students and coaches that went through it. We're able to learn with each of those individual people, how they scored, what they did, how they were able to deploy it. And what made it a really beautiful transition was we were able to see what happened on the clinical outcome side. So now we saw how those patients were doing with the doctors that were being deployed. We learned so much, and we're learning so much that we took an aha moment to say, why can't we do the same thing over here with an AI bot and a platform surrounding this entire engagement problem that we have today? So we've been blessed to be able to have a true deployment channel ready and waiting for us, which I know we'll dig into more, but we have a full engagement platform that we have built just based on the science. And that's where, of course, I could geek out all day on that stuff. So,
Well, it's so interesting because you have years of experience here. This is a big deal, major credibility. You've already been serving, I don't know the exact numbers, maybe you can share, but millions, a couple million lives and hundreds of employers using your innovation already. So you have a lot of insight, data, experience, expertise that you were then able to leverage. And now in the new world of AI, really bring all that forward in a new scalable way. That's really, I think, a huge opportunity.
yeah, for us, I mean, we're sort of at this turning point, maybe in a bigger word. That's a huge gift that we've been able to sort of unwrap right now. We have 130 plus employer groups that are essentially going to be in our control as of Q3 of next year. Essentially, because of the 8+ years that we've had this partnership, we've been able to prove year over year just these outcomes that these employer groups keep signing up. All these employers just kept coming back because their outcomes were so strong. They said, hey, InHealth, hey, do you want to take this over? And we said, absolutely. And now we want to do it bigger and better than before by having this true engagement platform, which CoachLinq as an AI certified bot is going to have a tremendous application, as Aubrey mentioned. It's going to be able to serve up what those employees actually have in their hands from their employers. Did you know that there's over 10 to 16 point solutions that these employers have, but they don't engage with it? And so I'll let Aubrey dig in here, but there's so much more that we're going to be able to do now that we have, number one, access right out of the bat. We have top line revenue right from the beginning, and we're going to do it all with all the newest tools and availability and the technology. So it's exciting.
I can hear the energy coming through in both your voices. It's so refreshing and so exciting. First of all, just congratulations. What are some of your biggest lessons learned and insights over the past decade? I think perseverance really seems to be a theme, and just kudos to you for your just ability to your doctorpreneurs, your health transformers, your innovators, but you're also just great entrepreneurs because you keep moving forward. What are some of your insights and lessons learned that maybe others can learn from? Because you've hit a tipping point clearly that I'd love more of the world to know about and to learn from what kind of got you guys through.
Oh my goodness. This could be a whole segment in itself. But yeah, I would say that one of the biggest things that we have learned is that if a solution is needed, it will remain here. And it will be very clear that it belongs on this planet and in this universe, and that you have to keep going. There will be signs.
Well, I loved what Michelle, you said a second ago about like the employers were calling you saying, we want this, we need this, our employees, our teams need this, and they're using it.
Yeah. Yeah. And that's the thing is, I would say the biggest lesson that we learned very early on was, and I heard this the other day, never do a deal when you're desperate. And that is one of the biggest lessons that I could teach any entrepreneur that's just starting out. Never take the first deal on the table. Never do a deal when you're desperate. always make sure that you have legal backing and someone with those legal eyes to take a look at what you're signing. Because that's one of the things that was our biggest pitfall that we could have ever made, right? And it put us 7 years behind where we probably could be today. You know, the good news is that we're still here and we have persevered in a gigantic way. But at the end of the day, it's a huge lesson, right? It's a huge lesson that we had to learn and we had to persevere through. And I actually just listened to your interview with Avonlea, which was awesome, by the way.
Thank you.
And it just showed me, like, she's 5 years in, right? And like her first investor was Esther Dyson. What a fantastic first investor, right? And I was just listening to that and going, oh my gosh, the difference, right, in our paths. I know that like it's hard on her path too. Like there's all of the challenges and struggles that we all have, but like the challenges and the struggles that Michelle and I have had are so different from that. And so that is one thing that like we learned a huge lesson from that, and like we'll never do that again. And that, you know, and so it's a good thing in the end, but it's really hard to go through.
It's so important. I mean, the relationships, I think, who you bring on as partners, who you bring on as investors, who you bring into your team.
Yeah,
If
yeah.
they're aligned, it goes one way. If they're just going to distract and negate, that's a whole other kind of set of issues you're going to be dealing with. So I'm really grateful that you're sharing that with other health transformers so that pay attention. Is there, how do you look for that? Is it one thing that we always, look for is what we call mission aligned investors? Like, do we have the same values? What kind of signals would you look for in the future, whether it's a customer relationship or an investor relationship or even hiring someone? What are the signals that matter to you or would be important to kind of know that or give you better insight you're making the right decision?
Yeah, and I would say it's exactly that, Unity. Mission aligned, trustworthy, honorable, honest. They believe in you. They're going to back you, not just with money, but with their expertise. People that believe in what you're doing and have been in the space for some time, and they have the experience and the knowledge and the network, and they care about you as humans first and foremost, right? So that's what I would definitely look for. And also just validate what they're saying. So make sure that you always validate when somebody tells you something, you can trust what they're saying, but also go and validate, right? Trust and validate, trust and validate. Those are major for us. But yeah, just being aligned with our core mission and then having the expertise and knowledge and network, and that all of those things are just invaluable. Yeah.
So you're coming out you're now in a really great position because you have long-term significant partnerships. You've got these tremendous relationships with employers. You have all this learning from really serving people and helping people with your solutions. Walk us into the future. Where do you go? Where are you going from here? Who are you trying to meet? What does the future look like for InHealth and CoachLinq?
Michelle, I'll let you take that one.
Yeah. We have a lot of big ideas. And I think one of the biggest of our ideas is the fact that we want to solve for this engagement crisis that's happening right now. There are so many solutions out there. We're sitting right next to so many billion-dollar companies right now on Live Health Online, which is American Well Anthem. And what we're solving for is that access problem. So many individuals, so many employees don't know what they have access to. And so for us, we obviously have a clear distribution channel through InHealth right now. So what we're going to start with is we're going to take CoachLinq and we're going to be able to drive outcomes right from the top of the gate. So for example, we did this with a large employer and we were able to show over 80% engagement, but at the top of the funnel, we were only able to activate 11% of the employee population. So if you can imagine, if we can get more people on the top Imagine how many can drive more outcomes. And we take all of that data down all the way through from how they get activated, they get engaged. Now, did they complete the program? Are they in the program? How are the clinical outcomes? Are they meaningful? What's that doing to their blood pressure, their weight, their A1, whatever, all those different pieces? The problem starts at the top, right? So if we can start looking at the top and driving more, that's going to help us. But if we can keep the engine churning all the way through that journey, imagine the exponential increase of outcomes that we'll be able to produce. We've been able to show this not only with one group, but multiple groups. We actually do the data, and it's amazing to see year over year, the employees getting healthier, staying healthier, and continuing on the program using their devices and interacting with their coach. So for us, our future is let's solve major problems at the top. Let's solve it in the middle, which is always rooted in engagement. We want to make it super easy, just like individuals using ChatGPT, millions have adopted it. And so we think that we can do the same thing. We know we can. We have some key customers that are on the InHealth side that have already given great indication of other applications, being pharma or being even in retirement community applications. So we have a lot of key customers that now activation is a problem no matter where you're looking. And so we're helping that with our future.
Who do you want to be connecting with? And then where should they go to connect with you?
Yeah, so we are actually getting ready to launch our seed round campaign to raise capital next week. So we are looking for investors. This is our first we wanted to do the interview with you all, and so that we had this as part of our campaign, because we know how impactful it is to work with Startup Health. And then Startup Health can really help us get out there and just the network again, and the mission aligned network.
Right, exactly.
So this is kind of the start, right? And so we'll launch our campaign next week. We're looking for strategic investors. We're looking for VCs that are interested in working with not only startups, but seasoned co-founders who still have, successful, like I still call InHealth a startup because of just,
you've been through a journey. I know you can't talk about all the details, but it's so impressive. I just can't say I've seen it not work out so many times. And it's just so inspiring to see how you both have navigated the challenges and come out stronger. And now in this position where you've got a great customer base, you've got a great solution, you've got a lot of data, you've got a lot of results and credibility. So for new partners coming in, it's a really great place because it's not like day two of you guys working together. There's a lot to work with here.
Yeah, there really is. And we're really excited about it. And we're so grateful to still be here. Like I told Jen the other day, there's probably a dozen different times where we thought, okay, this is probably the end. And then we would get like a new contract that was, a big, huge contract that would like keep us going a little bit longer. And those are those signs that I talked about in the beginning that are just like, there will be signs, right? If your product is needed, it'll be here. It'll be here. You have to persevere, and you have to make it to that next day, and then the next day, and then just figure out what you can do with what you have. And that's what we were able to do. We didn't have a lot of capital. We weren't able to raise new money. So what did we do? We went after the data route. We went after the academic route because we knew that we could do that. Right. We could do it well.
And just to be clear, the reason you weren't able to raise money is not because you didn't have an awesome solution and great team and great company. It was just structural challenges that we won't talk about. But now you're unshackled from those, and there's really a new opportunity here. So it's so refreshing to see when an inspiring team and great people and a great solution gets that opportunity kind of rebuild and come to market in very exciting ways. So I'm just really excited for you guys and for the world who gets to use your solution. So where are you based now? And I know you're really serving everywhere in the US, but where are you headquartered now?
Yeah, so Michelle's still down in California, in Southern California. That's where we started. I am now in Seattle, Washington, of all places. So
Very
I
cool.
definitely have technology all around me. I can't get away from it. So I'm just going to dive into it.
Well, I'm looking forward to hopefully seeing you both. Perhaps we're doing another event during JP Morgan this year in January, so hopefully I'll see you there. And also hopefully see a bunch of health transformers there. And if not there, hopefully very soon. We got to celebrate your wins while we can. Any last words, anything that you want the people to know, listeners, anything we didn't cover that you wish we did?
I think I'll take a stab at that one, but just keep going is kind of the best way to say it. Just keep going, one foot in front of the other. For us, we look back in this was our opportunity to look back in the rear view mirror and say, wow, we actually have accomplished a lot. And so I think a lot of entrepreneurs forget to celebrate the small wins. They forget to do that because when you look in the rear view mirror and you see all the obstacles that you've overcome, you need to give yourself a pat on the back. And so for us, we're built on credibility, randomized controlled clinical trials, all of these data and publications. We've got an academy, we've got an amazing, stellar team that are behind us. And now we're looking forward and we say, look, we have this army behind us. We can do anything. Ask us, a few months ago when we were going through all those obstacles, we might have said something else, but now we're at a different place. And so my message to the listeners is just keep going. And we are so open to partnerships. So I love other like-minded individuals and missions. So give us a ring, reach out and we'd love to have a discussion.
And then I would just say, look, we're here to stay. We are unshackled now. So be on the lookout for
I
all.
love it. This is so exciting. When we first started Startup Health, there were all these accelerators, Y Combinator, Techstars, and they were structured as very, usually 12 weeks was the time frame. And we very purposefully wanted to focus on long-term support, long-term relationships. And I think you guys are a perfect demonstration of why that matters. Sometimes it takes a few years, sometimes it takes longer. And the key is persevering through it and one step in front of the other. And then, I think a lot of the great successes in history are done that way. And you guys are proof that you're moving forward and growing bigger than ever. So thank you for persevering through and sharing your insights and inspiration with fellow health transformers.
Yeah, thank you, Unity. Thank you so much for having us today. We appreciate you guys so much, and we're just so excited to be more involved and just offer anything that we can back as well.
Cool. All right. Well, we'll see you soon.